Hello, everyone. My name is Misty Webb, and I'm reporting on my field practicum, which is the South Orange County Family Resource Center. The South Orange County Resource Center is one of 16 family resource centers in the network of the County of Orange Social Services Agency programs called Families and Communities Together. The specific resource center I'm located at is in Lake Forest, California. The mission structure. The FRC, or is also known as the SOC, serves those in the community that are at high risk of need, providing essential family and individual support services, education, and resources. What that means that they support families and individuals in need with or without insurance. They offer services to families that are in their own neighborhood, and they collaborate with the different agencies, hospitals, and nonprofits to be able to provide these services. FRC mission, goals, and objectives. The vision of the FRC is that all our children grow up in a stable, nurturing families and safe, supportive communities which promote healthy development and provide opportunities for children, youth, and adults to achieve their full potential as caring, responsible, and productive members of society. Their mission, as expressions of God's healing, witnessed through Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. The structure of practice, policy, and procedures is governed by two entities. The first one is FACT. Families and Community Together is a collective of partnerships between the County of Orange Social Services Agency and FACT Coalition of Charitable Ventures. The representative for County FACT program is Alex Thomas. Mission Hospital is the second entity which oversees all 16 resource centers. The representative is Christy Cornwall. Here's the agency structure organizational chart. At the top is Christy Cornwall. She is the director, and underneath her is administrative coordinator. And from there, there's various individuals who support supervisor positions and navigator positions. And then there's also Irma Garcia. She is the intern coordinator for both the Family Resource Center in Lake Forest as well as the Czech Resource Center in San Juan Capistrano. So we have two South Orange County resource centers. Irma oversees over 10 to 12 interns. So the major programs operated by the agency. So information referral services. They also have healthcare insurance enrollment. So for Medi-Cal, cover California, food stamps, and CalWORKS. Legal consultation. We also partner with the Public Law Center, who has individuals come to provide services. Case management, which is also Children's Bureau, an outside agency that comes in and does supportive programming, as well as Mission Hospital. When I say Mission Hospital, this means that this is staff of Mission Hospital, which to include all interns. So mental health counseling, Mission Hospital, this is Mission Hospital staff, as well as the interns. Support for domestic violence victims. This is Human Options, is a nonprofit agency that comes in to provide services weekly. Food distribution, we have support from Second Harvest Food Bank and Mission Hospital. This is staffing at Mission Hospital. So we have a walk-in food distribution every fourth Tuesday of the month. Advocacy is Mission Hospital. So this is all staff members and interns. And we also have volunteer opportunities for the community of those who want to be involved within Mission Hospital and their various resource centers. Additional services provided is family and health wellness programs, family economics and self-sufficiency programs, child development activities, emergency assistance, family literacy and education programs, classes and programs such as supportive groups, teen empowerment groups, individual women and men's groups. We also have life skill workshops and provide bilingual services. Our funding sources, programs and services provided for the FRC receive their funding from a variety of sources. So federal, state, and county agencies to include the U.S. Department of Health and Human Services promoting safe and stable families, County of Orange Social Services Agency, and California Work Opportunity and Responsibility to Kids, CalWORKS, volunteers, and also in-kind support and private donors. Agency leadership. At the top, there's Christy Cornwall. She's the director of the Community Health Investment. She oversees policy and practices at all the family resource centers. Teresa Jones, she is the manager of community services and community health investment. She oversees the two South South Orange County Resource Centers, CHEC and SOC, and supports the director with macro level projects, oversees outreach team called Health Advocates. Then there's Irma Garcia. She is the bilingual mental health counselor and intern coordinator. She oversees interns at both South OC Resource Centers and provides guidance of the clinical work, provides client guidance of the clinical work of the interns. She also contracts with the universities to select the individuals for the specific center needs, which is all the interns that are come in and interview and then eventually end up with the program with the centers. Collaborated and community partners. So the FRC and Family Resource Center is supported by a variety of different outside agencies from government to city, and then there's also nonprofit agencies and private businesses. Service delivery model and methods. The FRC programs are based on the 5 protective factors model, an evidence-based, practice-proven approach to strengthen families. The protective factors were developed by the Center of the Study of Social Policy, identify assets, approaches, and characteristics that foster healthy behavior and strengthen families. The 5 protective model is knowledge of parenting and child development, social and emotional competence of children, social connection, concrete support in times of need, and parental resilience. Interns use additional evidence-based models such as CBT, solution-focused, strength-based, and empowerment-based models and methods. Accountability. Stats for Mission Hospital. The database is shared with the clinical team as a report is submitted to Mission Hospital with stats for funding sources. What this means is we use a variety of programs that are used to document data collection that is integrated into the hospital networking system that is live, meaning that everything that we enter can be seen at the hospital any time of the day. Since the hospital is open 24 hours a day, they can access client information. For example, someone comes into the Family Resource Center and then ends up at the hospital, they can actually look them up and find out what services were being provided. VistaShare, documentation of families served, is another program that we use to document this information, and this is sent to the state for our funding. Epic is client records for all interaction and contact. This one is where the hospital is live. In FRC, we have an internal client tracker, which is our cases that we have are put into an Excel spreadsheet so we can track them internally. And that is the end of my programming for the South Orange County Family Resource Center. If you'd like to learn more about it, I've left the website here for you to take a look at. Thank you very much for your time and listening.